Hey, good morning and welcome to UroNurse News. I'm your host, Vic Senese. Be sure to like and subscribe. Today we're covering an important FDA update that expands the role of the familiar medication in postoperative pain, Caldolor, an intravenous form of ibuprofen. The U.S. Food and Drug Administration has officially expanded the indications for Caldolor injection to include management of postoperative pain. This update strengthens the role of non-opioid analgesia in surgical recovery and adds another tool for clinicians aiming to improve pain control while reducing opioid exposure. Caldolor, a nonsteroidal anti-inflammatory drug, or NSAID, is now approved for adults and pediatric patients as young as 3 months old. Management of mild to moderate pain, including postoperative pain, management of moderate to severe pain, including postoperative pain, as an adjunct to opioid therapy, and reduction of fever. This is not a completely new drug, but it is significantly expanded clinical indication that broadens where and how it can be used. Postoperative pain remains one of the most challenging aspects of patient recovery. In recent years, healthcare systems have increasingly prioritized multimodal opioid-sparing pain management strategies. This FDA expansion supports that direction. By incorporating IV ibuprofen earlier and more intentionally into postoperative protocols, clinicians may be able to reduce reliance on opioid medications, improve baseline pain control, and support faster functional recovery, and potentially reducing opioid-related adverse effects. This represents a meaningful step in the ongoing effort to balance out effective pain relief with safer prescribing practices. A recent study evaluating intravenous ibuprofen in older adults found several key outcomes. Patients receiving IV ibuprofen experienced significant reductions in postoperative pain compared with placebo, lower opioid consumption postoperatively, and, importantly, a reduced incidence of adverse events compared with the placebo group. That combination, less pain, less opioid use, and fewer adverse events, is what makes this finding clinically relevant. From a practical standpoint, Caldolor is supplied in two formats: 800 milligram, 8 ml single-dose vials, which must be diluted prior to IV administration, and a ready-to-use 800 milligram per 200 ml single-dose bag. This flexibility allows hospitals and surgical centers to integrate the medication into a variety of infusion protocols, depending on their workflow and settings. Now, in conjunction with the expanded FDA labeling, Cumberland Pharmaceuticals has also launched a new educational website dedicated to Caldolor. The new site provides resources for healthcare professionals focused on non-opioid pain management strategies, reinforcing the broader shift in perioperative care. So what does this all mean? This FDA expansion reflects a continued evolution in how we approach postoperative pain, moving away from opioid-heavy regimens towards balanced multimodal pain control strategies. Caldolor is not replacing opioids entirely, but it may help reduce the amount needed, improve patient comfort, and support safer recovery pathways. In today's clinical environment, even incremental improvements in opioid reduction can have a meaningful long-term impact. I'm Vic Senese. Thanks for watching UroNurse News. Tomorrow, we're taking a closer look at a rapidly growing concern hiding in plain sight: eye injuries on the pickleball court and other ball sports across the United States. What was once considered a low-impact recreational game is now showing a surprising rise in serious ocular trauma, including corneal injuries, retinal damage, and vision-threatening blunt force impacts. How is this happening in a sport millions call safe? We'll break it down with real-world injury patterns, why they're increasing, and what simple protective steps you can do to prevent permanent vision loss. If you play pickleball, tennis, baseball, or any fast-paced ball sport, you may want to watch this one.
Breaking news, clinical guidelines, and research insights delivered weekdays at 9 a.m.
UroNurse, where the experts meet. Online learning, practical and sweet. Every Saturday, 9 a.m. Central Time.